It's the Morning Brew. Welcome to the show Wednesday morning. I am Larry Aarons along with our guest co-host this week, Nika Allen. Doing
Hello.
a good job.
Thank you.
Nice to have you. Hey, from the very beginning of this program, our good friends at Lovelace have been supporting us, and we're very appreciative of that fact. And we're starting a new segment with our friends at Lovelace. It's called Love Your Health, and we're going to be featuring, hey, look at that. We're going to be featuring a lot of the experts and medical professionals and healthcare providers from Lovelace over the next several weeks and months. And guess who gets to start that off? It's Dr. Jeff Thomas, who's with us today from Lovelace. Welcome to the show.
Thank you very much. Good morning to you, and thanks for having me.
You are a family medicine practitioner there with Lovelace, and you're kind of new to the community, too.
That's true, yeah. My family and I recently moved here, and we're still setting up shop, but happy to be in Albuquerque. And
So far, so good?
So far, so good, absolutely.
The kids liking it?
Yeah,
Good.
they do. They
Good.
do.
All right.
It's a change.
Yeah, it's quite a change. You came here from where?
The Philadelphia area.
Okay.
Wonderful.
Yeah.
Yeah, a little drier here.
A little drier, but that spectacle of the mountain in the distance, you can't beat that. Waking up to that every day, it's
Yeah,
great.
it's
Well,
beautiful.
it's always great to have new talent in town and good family physicians, and I think you're one of those.
Well, thank you.
Great
Thank
to have you here. We're going to talk a little bit today about, and this isn't your area, you're not an OBGYN, but we're going to talk about C-sections a bit today on the program. And there's been a lot of news about the increase in the number of C-sections women are having, giving birth, and Lovelace is doing some things about that. Let's speak to that a little bit.
Yeah, it's been a steady increase in the C-section rate for decades, really. And nobody knows exactly why that is. There's all kinds of different theories, and probably the truth is somewhere in the middle of all of them. But by now, the national C-section rate is it's just over 30%.
Wow.
Is the number that, so almost 1 in 3 births is surgical instead of, the traditional route.
And the C-section rate at Lovelace is lower than the national average then. That's what I understand.
Considerably lower, yeah. At the Women's Hospital, they're around 17%, just over. I think 17.1% is the latest number there, which is about half of the national average. And I think, they've achieved that through, following guidelines very closely and making that a goal to try to get women through a vaginal birth as much as possible. Certainly they have a strong certified nurse midwife program,
Right.
And that has helped, keep the numbers low.
Great.
Now, when women start seeing an OBGYN provider, it's really important that they get that care early on in the pregnancy.
Yeah, ideally, women who are interested in becoming pregnant would come in several months before they were going to get pregnant. A lot of times they've already been on birth control for several years. So there's a whole process to coming off the birth control and getting the body ready to get pregnant, and that's the ideal.
As a physician, you want to see the patient when they're healthy, right? It's preferable.
It's preferable, yeah, if you can,
And have that relationship started.
Yep.
Yeah, and Lovelace can really, I think, help people kind of prepare for that pregnancy. And, there's more than you have to get your mind, ready, your body ready. And I think Lovelace seems to be able to help you go through that process.
Yeah, it is a whole process. They have over 20 providers for obstetrics and gynecology to, help women get ready for that.
And this program with certified nurse midwives, that's kind of a new thing too, and that's really working out well with Lovelace.
Yeah, it's almost like going back to the olden days, sort of,
Yeah.
more attention to more traditional birthing practices and trying to just do things as naturally as possible.
Now we're showing some graphics of the birthing centers here that Lovelace has, and they have 2 of them.
That's correct.
One on the west side and then one at the Lovelace Women's Hospital. And nice looking places. Take a. Yeah,
Oh my
this
gosh,
is.
this looks like a hotel.
It does. Looks like a resort.
Yeah.
Which way to the
I'm coming
pool?
there.
And this
Oh
is
my
Women's
gosh.
Hospital. This has really been quite the trend to
Yes.
these birthing centers, and it's a very comfortable setting for not only the woman but her husband or the man that's along.
Once a mother gives birth in one of these rooms, there's no going back.
Yeah.
This is the new standard for sure.
Yeah, this really is
Yeah.
setting a whole new standard. I've never seen anything like that, to be honest. But
Well, you can see it has a very cozy feel to it,
Yeah.
and so the mother is very comfortable there. It's very private. It doesn't have that medical feel to it as much.
Not at all,
And
yeah.
everything takes place right there. And, if it's a vaginal delivery, so from the beginning part of labor right through to the end, it's all going to be in that room, which is really nice.
This is wonderful. Now there's a health fair coming up on Saturday, May 17th. I think I'm informing you on this. This is we've got a graphic on this. It's called the Bump to Baby Health Fair. It's going on at Lovelace Westside Hospital Saturday the 17th. You can see the time there, 10 a.m. to 1 p.m. And this is a baby and maternity-focused health fair, a great event for everyone and anyone who has had a child in the past year or is currently expecting or is planning to have a child in the near future. I would imagine they're going to have all their healthcare professionals out there and answer questions. And
They're going to have lots of services available for, just answering questions or, taking care of babies that, just like you said, have been born in the last year and getting ready for the next babies that are born.
this is what I really enjoy about Lovelace, because I sense that this medical group and this health group is really about getting information out to people, no matter what it is, whether it's pregnancy or any other health concern. In my dealings with Lovelace, they're very, very giving in terms of giving of their knowledge and expertise in all areas.
Yeah, I think that they've made, engaging the community a priority for them.
Yeah.
And they're really trying to, provide services that people are interested in.
And now you as a practicing physician, you're kind of busy, but this is. Do you consider that part of your job too? To
The community outreach?
Yeah, to connect with people.
Absolutely.
Outside of your practice.
Absolutely. Yeah, for me, it really started in the neighborhood when we opened the office in September. We invited the neighborhood.
Oh, did you?
In to
That's
come and
nice.
see the tour of the facility, to meet the practitioners and the staff, and because we wanted them to know that we were there and that we were going to be there for them. So, that's really where it started for me, and gradually I'm building the network out farther and farther.
yeah, you're here today, so
Now you've
that's
added
great.
TV to the
So-
resume here. This is good.
Yeah.
This is really good. Your office in particular is over in the Heights near Casement, right?
We are on the corner of Constitution and Wyoming, right there. It's been a medical building for many years, I guess, but Lovelace just took it over and opened up the office in September.
Good.
So, yeah, we're accepting new patients. If you're looking for a primary care physician,
Not a bad idea.
sure. Yeah.
That's wonderful. That's wonderful. Oh, let's put the graphic up again, Dan. I want to talk about this event again. It's a health fair on May 17th, and it's called Bump to Baby Health Fair, and it's at Lovelace Westside Hospital. You see all the details there, and contact Lovelace if you want more information. At Lovelace.com, they have all the details. Hey, it's great to meet you.
Well,
and
thank
have
you.
you on.
Thank you so much.
We invite you to come back anytime.
It'd be my pleasure. I'd like that very much.
Thank you, Jeff. Dr. Jeff Thomas with us from Lovelace today. Dr. Thomas is a family practice physician with Lovelace Medical Group. Okay, Nika and I will be back. We're going to tell you about a great place to dine with Mom on Sunday. And that's next here on The Morning Brew. We'll be right back.